welcome again. We're starting our healthcare PPP session. And I would like to say that we have quite distinguished speakers today. First of all, as you could see, we have a gender equality here. It's not very often happens like this. And also, I'm very pleased because this is, I would say, top PPP professionals in the healthcare sector. So thank you for coming, to all speakers. Thank you for making it to Abu Dhabi. We also were working to balance the interests of public and private sector. So we have a representative of the governmental agency and leading companies working in healthcare PPPs, and also international financial institutions represented by IFC. With that, I would like invite speakers to briefly introduce themselves, starting with you, Dr. Ibtesam, please.
Hi, everyone. Good afternoon. It's my privilege to be with you all this afternoon. I'm Dr. Ibtesam Bastaki. I'm heading the investment and PPP in Dubai Health Authority. It's a government entity belong to Dubai government. My background, I'm a family physician as a practitioner, and I studied in Dublin, Ireland, and then I worked in a various fields within healthcare from public and private sector, and now I am with the Dubai government.
My turn. Karine Bachongy. Nice to be here today. Thank you for inviting the IFC to speak. I'm globally responsible for social infrastructure, so health, education, and affordable housing at the PPP department of the IFC. What can I say? I come from the health sector. I was seconded by the Ministry of Health of France to the World Bank Group.
Hello everyone, Assalamu alaikum. My name is Moustafa Fahour. I'm the Chief Operating Officer for Plenary in the Middle East. I look after Plenary's business here. Plenary is a PPP predominantly company headquartered out of Australia and based globally right across the America, Europe, Asia, and now most recently in the Middle East. We focus a lot on social infrastructure and healthcare. We've probably completed globally nearly 27 different hospitals in a PPP format. So I look forward to the discussion and being here today. Thank you.
Thank you.
Hello, everyone. Sorry, let me remove this. Hello, everyone. Thank you very much for the invitation. My name is Sergio. I'm heading the Entreprise Services Middle East and Africa organization within Siemens Healthineers. This organization is the one that is responsible for, let's say, designing and managing large and complex projects within the Siemens Healthineers spectrum. My background is related to Europe and Italy specifically, and also my expertise is very much related to digital transformation and in general strategic transformation projects.
Thank you very much. Maybe I will also briefly introduce myself. My name is Natalia Korchakova-Heeb. I am the chair of Healthcare PPP chapter in the World Association of PPP Units and PPP Professionals, organization which hosts this PPP forum. And at the same time, I'm PPP speaker for German Health Alliance and global lead for PPPs and Greenfield hospitals in Siemens Healthineers. And the healthcare sector is very important. It has a huge impact on communities, on patients, on us at the end of the day. And healthcare, obviously, we know about Sustainable Development Goals, and we would like to achieve SDG number 3, access to care and well-being. And you know that according to Sustainable Development Goals, PPPs are seen as the instrument to achievement of SDGs. And since we promised you a very interactive session, we actually would like to have a lot of questions from you at the end of the session. So feel free to already think what kind of questions you would like to ask speakers. And also, we would like to give you update what is happening in healthcare PPP sector in the last 5 years. So every speaker will have an opportunity to give you a very short update what, from his point of view, has happened in the last 5 years in healthcare PPPs. Please.
Thank you, Natalia. Basically, as Dubai government, since the establishment of Investment Department and PPP within Dubai Health Authority in 2018, we had a plan in terms of how to improve the infrastructure PPP projects in Dubai. And you all know Dubai environment of healthcare sector is quite unique because you have a dominant of the private health sectors where you can have more outpatient, inpatient volumes in the private sector, 80% comparing to the government, which is only 20%. So still there are some gaps in the market where the government wants to invest in certain specialities to meet the requirement and the needs of the people. Therefore, the governments have put some of the objectives to focus on those projects from the PPP perspective. And we all know that PPP is a great tool where you can use it to have the correlations or cooperations between the public and the private sector, where you can distribute even the risk among them. However, nowadays, honestly speaking, and as I mentioned, because of the capacity planning and the requirements and the exist of the private sector in our market, we really need to think beyond the infrastructure element. So why we don't have more into public-private partnership in a soft infrastructure where we can have a better accessibility for the patient, whether it's a financially or physically, and that will be in the area of digital and technology. And this is something that we are looking at it at the moment. It's on our table. We are engaging different stakeholders, and hopefully we can see some kind of results in future.
Excellent. Thank you. Karine, over to you.
Yes, I'd like to build upon this. I mean, what we see at IFC is a huge increase in requests from governments to develop health PPPs. I think, of course, there's the effect of the pandemic. Obviously, I think that it's clear for everyone that public health services have to be ramped up. So we actually more than doubled the number of transactions that we are working on. And I would agree, in terms of trends, what we see is that the scale of these PPPs have increased, in the sense that you no longer tackle one facility, you actually tackle a network. And this network is built upon a sort of hub and spoke model, right? Where you have a hub with resources and then telemedicine to accompany, to set up this network. And with an operator which is able then, thanks to this network, to reach remote locations. So this is what we see, increasing the reach and increasing the scale of these projects.
Thank you, Karine. Thank you. I think it's, especially for developing countries, I think it's a change of paradigm, because it's not about physical infrastructure, but development of all, I would call it alternative PPPs, if you wish, because this is what, let's say, mobile hospitals, the modular hospitals, digital telehealth PPPs. This is a new type of PPPs which only possible in healthcare sector, and that's why healthcare PPPs is quite special anymore. Over to you, Moustafa.
Yeah, I think the ladies make some very good, valid points. For us as Plenary, what we've seen in the region is the appetite of the governments, especially across the GCC, to bring the private sector. Having experience across Australia where PPPs, New Zealand and more of the Western world where they've been around for quite a while, seeing the growth in social infra and now, more importantly, healthcare. We've seen, 2 projects, kick off. So you've got DHA with their cardiology centre, which, really set a lead and an example of how you can get the private sector involved in running a PPP, a specialist PPP or cardiology centre. And then, and most recently in Saudi Arabia, where you see the Al Ansar hospital. So seeing the appetite of the government to get the private sector involved really helps stimulate, especially with the growth of the population, but to deliver something that can contribute a whole of life, I think really stood out for us. And if you got the support from the government, the people and the private sector, really it shouldn't stop you from delivering what we call, a state-of-the-art, healthcare projects.
Thank you. Sergio?
Yes, I absolutely agree with all of the topics. I would say that in general, what we're seeing is a shift from the transactional, let's say, purchasing of medical technology towards a more value-based approach where you prioritize the quality of care and the efficiency of the operations in order to provide more value to the institutions. And this is where I believe that the private sector can yes, provide more value in partnership with the public. And in general, let's say, within Siemens, we actually defined a new approach that we I would like to invite everybody that is interested to look in our website, because we published a white paper related to this, where we introduce the topic of combination of the classic value for money type of approach, and adding to it the value for people and value for innovation. And where the value from innovation, let's say, driven by data-driven approaches, by digital transformation, by partnering with the institutions to actually address what the challenges, the real challenges are, that's where we believe that we together can provide more value and ultimately increase and optimize the patient experience, because that is where I believe is the golden standard that we need to go to.
Thank you. My main takeaway from this first round of questions is that the world is changing, healthcare is changing, and therefore healthcare PPP also changing. They are also evolving. We will see new models, new type of services, new scopes of PPPs. And we try to combine global and also regional experience, and having a privilege of having with us. Thank you once again for coming. Would you like to elaborate on the pipeline of your government and maybe already existing pilots that you have in healthcare sector?
Well, we have done a couple of partnership projects for the past couple of years. We started with service partnership, like an operational management from dialysis rehabilitation perspective, which was being signed a contract 2 years back. And so far we are just looking at a certain clinical KPIs and how the private sector is managing our patient, which looks a really good kind of like a knowledge transfer, experience exchange, and so on. And then in parallel, we were working on the real infrastructure PPP projects like Cardiology Center of Excellence. And why it's infrastructure PPP is not just because of the brick and steel and building. It's basically where you want to have a center of excellence where you can bring the knowledge partners and you can learn from each other, as well as you want to improve the training, research, capacity building, and you need the workforce. I mean, the world's going to have an issue in a couple of years regarding the shortage of workforce. And if we don't develop it properly, through that kind of a concept, I think this can, impact the healthcare system. So now at this stage, in terms of the cardiology, we're still at the recruitment stage. We are waiting for the final management decision into it. And hopefully it could be a good example, very unique, customized, meeting the requirement of the population as well as the stakeholders. And it's a win-win situation between the public and the private sector. It's very unique because it has a clinical knowledge partner within the consortium itself. So it's not the typical like a PPP that you see in other parts of the world. So, and the other projects that we are working on it's the digital, it's still under the high-level discussion, but we are aiming something can happen and we can consolidate it in near future. And that's mainly focusing on the prevention aspects, because see, we are still dealing with sick system. We are not dealing with health system. And you really need to focus how you can shift the system itself from sick from diagnosis and treatment to prevention, and to have a high level new medicine where the practice is happening at the moment, to develop, to improve the well-being of the population, because at the end, patients and people should be your centric. The rest should be your ecosystem working around it. So whatever you're doing from the public-private partnership, you really need to focus on your patient. Being as a physician, I always have a sympathy regarding this, and I always want the patient come first. And the accessibility, if it's difficult in terms of financially, you can have digital coming as a first, because it's more affordable and more accessible. So there are lots of things that you can do between the public and private sector. We are discussing at the moment, and hopefully that can be consolidated in near future.
Thank you very much. First of all, this project that you mentioned, Dubai Cardiac Center of Excellence, it's a long-awaited project. So fingers crossed it will be approved in the nearest future.
And with lots of challenges.
A lot of challenges. We have Moustafa, maybe he could also help us to share your experience because you were responding to this tender. So from your perspective, what were the challenges in the tender procedures or maybe globally in this tender, but also globally, what kind of challenges you see in the healthcare PPP tenders?
You're putting me in an awkward position, Natalia. I've got my client just here. Look, challenges are experienced everywhere.
Yeah.
And I think what's great about the governments here and their procurement method is they're visiting those countries to understand what those challenges are and how they can sort of, try to find a solution to them. Because everyone thinks a PPP is a rigid process, but in actual fact, it can be customized and changed, as Dr. Ibtesam was saying. So, having this unique process where they brought a knowledge partner, it's someone, a very well-known brand from, whether they're UK or US, etc., to really be there to create it as a center of excellence. So it's not just about treating or providing, but it's also about educating. So when you start customizing that, it does add some additional challenges. I think technology is another example. How do you bring medical equipment? And I'm sure you probably, Siemens, we'll probably can discuss it in a bit more, but how do you bring the latest technology? And then how do you maintain that for, 20 years and price in those 20 years? So I think what we're seeing is an evolution, because the history of PPPs around the GCC has really been around energy, power and water and this IPP structure. And social infrastructure and healthcare has been a relatively new process. So how do you adapt from that sort of mentality to the new mentality? Because social infrastructure, healthcare is very different. And the structure is very different, where you aren't looking at VFM because you're providing a service to the community. And how do you value that? And then how do you bring the latest technology and information? So these are the challenges. You can't benchmark a VFM when you haven't done one before. So how do you do local benchmarks versus international? So these are the challenges we've seen through the process. But the good thing is, because they're relatively new, procurers are open to discussions, to have these, to try to tap it on its head and get to a solution where you end up getting, hopefully, an award.
No. Well, thank you. Well, you didn't mention any challenges as such. So I have to come back to this. So because I know Plenary very well, you're very active in different jurisdictions. You're very successful in Canada, in Australia, you're going to other jurisdictions. So what kind of recommendations you would like to give the governments when they pursue healthcare PPPs in terms of procedures? For instance, we know that Australia is also compensating the lowest bidders, for instance, which is very interesting. Maybe you could mention some concrete examples which our guest audiences could take home with them.
Sure. So as you know, competition is quite, when a developer looks at a country or a place to participate, PPPs and, setting up the process of it is quite expensive because, they take time. They could take up to 12 to 24 months. So you're investing a lot of money into this process. And because social infrastructure or healthcare is relatively new and you're seeing a delayed process, stipends is a good example. We don't see this in part of the GCC, where if a project does get cancelled or a project does change or get delayed, the competitors or the bidders have an opportunity to get some of their costs back. So we've seen these models internationally. And this is a way to help increase competition. So it's not just to compensate, but what you'll get is more international developers wanting to participate. So stipends is one example. The other one then is pipeline. You know, we heard Dr. Ibtesam talk about pipeline. When a developer's entering a country or wants to come, because of that level of investment, what they'll look at is the pipeline. You know, is it a long enough pipeline that, you know, provides sustainability to bring your people, bring your talent? Because it's quite a niche specialty that you don't really find, you know, commercial, technical, financial experts in one house that are there leading a consortium, putting equity in and sharing the risk with the government to develop these. So, you know, two main challenges we see in some parts is, you know, stipends is an interesting concept to look at, and the other one is around pipeline.
Yeah. Do you want me
Yeah,
to
sure,
add?
absolutely, yeah.
Looking at myself being part of the project, especially like CCOE, there were some lessons which when I go back 2-3 years, and I wish I did it. First of all, when you're building your feasibility study, it's very important to engage every single individual. Sometimes it doesn't work from top to bottom, it should be bottom to top. So it's very important to engage all your stakeholders, having the buy-in towards this project, so you don't get, you know, raising flags, or somebody wants to, you know, disagree with the concept, or, you know, because it's a change to the whole government system. You're bringing new talents, new people, new system to the floor. So this is something that buy-in is very important at the beginning of the project. Then, even though I was working for government many years, but still I missed some of the area which I didn't know it was there or was mature enough in the system itself, which impacted on the projects. I'll give you an example, like a medical equipment planner. So we didn't have that. Actually, it's impacted on the timeline of the whole project. So it had made us to work again and then put it into the bid process so the bidder can respond to us. This is something that it's very crucial. When you're doing something, you should not get too excited to do it fast. Take your time, understand the system very well, and put things in your plan. The third thing I always say, whenever you have, especially in GCC, we always have organization people changes. This should not impact your project. You have to go and talk to them saying, listen, this has been made, this has been blessed, we need to go as per direction. You new people, don't stop it. If you want, if you have any gap, fill those gaps with the new ideas and innovations. Don't come and stop the project because it's already been gone. You're new to the system doesn't mean you have to stop the project. So these are the things I think you as a leading the project, you should basically take the gut and go and discuss and lead the whole process A to Z. This is actually my...
Bravo. I mean, when we were doing kind of a prep for the session, I had a call with Dr. Ibtesam. I was absolutely excited. I never met such an aspiring governmental official who is so much believe in PPP projects in healthcare and the topics that you mentioned. It's also, you know, prevention medicine, etc. I wish you a lot of luck with your work in what
Crossing
you do.
fingers.
Thank you. So then let's maybe ask Karine, who represents International Financial Corporation and is in charge of actually transaction advisory services to the government. So you are supporting governments and structuring healthcare PPP projects. So first of all, how you see PPP, healthcare PPP contribute to universal health coverage, and maybe you could elaborate on your work around the globe.
Yes, and I have to say that the number one success factor for us is this commitment, the political commitment. So I'm very, very glad to hear this. So yes, what we do is, I mean, so IFC has different divisions, obviously, but there's a whole department with about 130 investment officers delivering this transaction advisory service. So we start from the very beginning, for example, to help governments put the pipeline, so screen the right projects, prioritize the projects, and then we help them to develop from scratch until the signing. And sometimes we even say 18 or 24 months after the signing of the project or even the financial close for all the commissioning and setting up the communication between the partners, because we think that's also of tremendous importance. So universal health coverage, look, this is the goal, right? It's the SDG 3. That's what the governments have to aim for until 2030. And what we know is that there's a huge gap to reach this. I don't know if you have read, but in The Lancet there was a very new publication about universal health coverage, that in the low-income countries the money is not there, effectively, saying that even if an average low-income country would spend 20% of the revenue of the country, still they would be 4 to 6 times lower than what is requested to reach universal health coverage. So governments have no choice, they have to associate private sector. But what I would like to do is perhaps to provide a few examples of what we did to help the countries reach this universal health coverage. We have a short video which basically gives 3 examples. So if you give us your attention for 2 minutes.
It's already
Then
started.
we will give, yes.
There's no sound possible. Actually, the sound.
So maybe Karine, you could comment when we are watching the movie.
The sound is only of music. But in fact, so we here have the new hospital in the Boza Hospital in Colombia, the first ever hospital PPP, or the first ever health PPP in the country, which is going to open in January. Now we shifted to Albania Labs. It's a project which is over 18 university and general hospitals. Basically, there's one hub and spoke model with the samples are traveling with biosafe logistics and no longer the patients. And then through information system, a lab information system, the results are sent back to basically the practitioners. So this is a nice project because they shifted from low quality issues with reagents, the equipment was outdated and so forth, to a top of the range network. So yeah, and the third one is the Uzbek dialysis. It's, I think the first or the second in Central Asia, over 3 regions. So one provider, again, a bit of a hub and spoke model, but providing dialysis care in 3 regions, and 2 of them being very remote, and also helping to retain also the workforce, the very qualified workforce. We worked also to help the government to revamp all the standards around dialysis care. So these have opened, and the last one in Tashkent a month ago. So very recent examples. Now the Uzbek one is also a good example of how you reutilize public funding to increase the quality, because the price per session is lower than before, 15% lower, but the quality is up to international standards. So that's why I thought it would be interesting to show these examples. Very concrete ones.
Yeah, thank you very much, because it also shows the different geographies where you work. And I think our audience would be interested to know, do you always have the same approach, or, like you're structuring in the same way, or every project is unique and you end up with a totally unique structure based on the country specifics, based on the specific healthcare situation? Maybe you could elaborate on that.
In the IFC, 15 case studies in diagnostics PPPs to basically learn about the different structures, how things went after implementation, and try to extract the lessons to apply to different countries.
Maybe we could show the slides.
Yes,
right?
It would be great to have the slide. So this is going to be available on our website, and it's very good reading, I think, for PPP units and also perhaps for operators to see how things went. Now, one of the key elements is prior experience. One of the key success factors. Projects go better and better when governments and countries gather experience. So one of our key sort of advice is always to try to start with simple projects, learn as you go, establish the trust of the market, and then develop more complex projects. And you will say, okay, but if you start with the first one, how do you do this? And I think there's a very strong role for PPP units to also explain to ministries of health how things go. You know, in Ministry of Health, you have a lot of top experts in the sectors, but maybe less in infrastructure and investments, in financing. So the PPP units, in my view, have an important role to sort of support this learning experience. So look, the report is long, but it gives, I think, we try to summarize 5 good lessons to extract. And of course, I could talk for long, but this experience and trying to gather lessons from other projects in detail, not just the surface, to then implement and customize into one's country is very important.
Yeah, I had a pleasure to see this advanced version of this report, and of course I welcome very much this effort to publish this report, because I don't think we see too many publications in healthcare PPPs, and I think we market want to see more and more research, more recommendations, more case studies, and this is of course my request to all audiences. Please do something. Yeah, we are lacking this knowledge, and every jurisdiction is very different, and there are so many lessons learned, honestly, yes. And we have to do this. So maybe coming back from to you, because you mentioned that you were learning a lot, and you also visited some countries, yes, where you were visiting PPP units and they were trying to learn them. Maybe you could explain how it works.
Basically, I visited Australia as well as Canada, and I looked at their various projects of the PPP. What I learned, especially in Canada, they had, even in Australia, honestly, they had a good infrastructure PPP unit led by the government, and they had, so it was kind of like centralized, So, and underneath that, they had the projects from various sectors, whether it's a health, a school, security, and others. And they were doing the project based on the requirement, and because they understand it very well, so it was easier in terms of funding and implementations. So I was quite impressed in terms of having that centralized infrastructure PPP unit sitting within the government and overseeing all their projects. And they have the accountability as well, with a very tough KPIs that, how they monitor the projects. So we try to learn some of them, and we actually and took some of those ideas and implemented in our cardiology as well. And that's why a lot of private came to us and say, well, your KPI is so tough. And I said, well, benchmark and look at the other countries. They have the similar things. So, we need sometimes to learn. We tried our best to get the right knowledge from different countries, to bring it and customize it to our model as well. So this is the 2 countries where I really enjoyed it, and I really loved seeing their projects. And still, I always ask my colleagues if there is anything new I want to go and see. Not necessarily at the infrastructure hospitals or clinic, but maybe sometimes at the specialized services like laboratory, dialysis, maybe rehabilitation, mental health. Nobody's talking about mental health. It's a big problem. It's going to be a huge problem. If we don't become proactive now, it's going to take a lot of burden on the government how to invest on the mental health, and technology going to play a great role in mental health. So therefore, we need to develop all these kind of tools to support our populations, and to encourage and build a good prevention methodologies in that area.
Thank you. And now, Sergio, you are
yes.
In focus. So Siemens is doing PPPs more than 20 years. And of course, as a medtech company specializing on innovation and technologies, maybe you could elaborate how technology could be enabler for healthcare PPPs.
Sure. So as we said, we've been doing PPPs for a long time and building upon the experience, especially the experience that we have done in countries like UK or Netherlands, where at the time they were called managed equipment services. But we built upon the experience that we did, and we defined a concept that is called value partnership. I think that there is a slide that we are seeing, but there, oh, here it is. So the value partnership is a concept that is related to creating long-lasting KPI-based relationships with our partners that answer a lot of the questions that were actually asked earlier. A lot of the questions, a lot of the challenges that we are. How do we make sure that the equipment that is needed stays relevant for the next years to come? How do we ensure that there is no skill gap? How do we ensure that there is education programs that make sure that the equipment is used correctly, efficiently, and effectively, right? How do we make sure that the workforce is ready for it? How do we make sure that the planning for the facilities is done in the most effective way and creates the most value for the patient? How do we make sure that the clinical pathways are optimized? All these questions that go from prevention up to the treatment, let's say, for even we have specific solutions for different pathways, going from cardiology to oncology, stroke, etc. So we have, let's say, comprehensive solutions in all of these pathways. And we have specific solutions for each one of these topics. And we have a framework to enable our partners to achieve the value that we promise. We do this through, let's say, leveraging the digital transformation and let's say the pervasiveness of digital solutions, where we specifically measure KPIs. We define and we measure KPIs. We measure how these KPIs are evolving over the years to measure improvements. And KPIs that can be even related to outcomes, okay, or to clinical relevant, let's say, topics. I don't know, for example, KPIs like door to needle in the stroke management. All these can be measured specifically, and we can see what value we bring within these partnerships by measuring the evolution of them. Digital transformation also is, let's say, creating what we call digital twins of the facilities to make sure that we're planning correctly and we're planning for the future effective solutions. How do we optimize the use of the equipment? How do we make sure that the utilization rates are on par with similar or even better than similar institutions across the world? We can do benchmarking across the institutions, and we have solutions that help clients actually, or partners, sorry, actually measure themselves and keep track of the evolution over the years. We do all these. We also have solutions related to strategic transformation, where we analyze, for example, we talked about prevention. We analyze population health management topics to make sure that, let's say, the business case related to specific clinical issues can be dealt with prevention. We make sure that if we have screening programs, these screening programs are effective. How do we leverage technologies like artificial intelligence within these programs? These are all topics that we handle through our value partnerships. And besides all this, we also define some very effective business models that can accommodate specific needs. These can be traditional, let's say, based on, let's say, monthly payments over the years and guarantee the evolution of the technology and the, let's say, the optimization of the process, but can also be value-based. So let's say the parameter is the KPIs that are defined together with our partners to make sure that once we achieve what together we, let's say, set out to achieve, we actually then define the benefits. And it needs to be a win-win relationship between private and public. So this is, let's say, the approach that we're using when we are talking about PPPs. And I believe it addresses a lot of the conversations. We do advocate for PPPs to be, to have specific areas that are related to the medical technology, to make sure that it is not, let's say, a small portion of a bigger, and let's say a bigger elephant that needs to be divided. We advocate for to make sure that private medtech companies can provide the value that we're promising. We need to make sure that the framework also accommodates something, to go in this direction.
Well, thank you for such elaborated answer, and maybe a comment from my side for our audiences. When I joined Siemens 2 years ago, I looked at the value partnerships and I thought, that's look exactly like PPP project to me. It's a long-term, it all has financing solutions. It's about, delivering value for money to the customer. So there are all prerequisites there. I mean, all the main features of PPP is there. So I start thinking where it comes from, this concept, and actually it's come from managed equipment service concept, which was developed in UK. The first managed equipment contracts actually coming from UK. They start doing PFI contracts, and then they said, why not do the same for medical equipment? So they inventors 2 times, not only PFI model, but also PFI model, but also so-called MAS contracts. And maybe the question, because I think it's also important, the procurement modus, because I think one of the biggest advantage is the direct contact with the clinical partners, because it's the construction and facility management companies, they actually would like go away from those risks, and would like to delegate to more experienced partners, risk sharing, obviously. And so the question how to accommodate it in the procurement process, right? To make sure that we are not just selling boxes, but we are selling solutions.
Yes, for sure. The topic is that players like us should be involved as soon as possible within the design of the program. And the mechanism that is usually used is interface contracts that can accommodate for the correct design of the solutions to make sure that we are accommodating to all the needs of the project itself. So let's say the request is to involve institutions like ours as soon as possible, so we can absolutely help and define these. We have examples that we can reuse, but we can define the specific ones for the case that is on hand, so that we make sure that everything goes, let's say, smooth over the years, and it's not an easy topic, let's say.
I'd like to expand a bit more on that, especially around interface. I think what's, and it goes to your topic as well around centralized procurement units. We can talk about the challenges and the learnings, but also where the GCC countries have adapted. So where you see procurement centralized, like Abu Dhabi Investment Office or NCP out of Saudi Arabia, because the understanding of interface and the risk that you face between the medical equipment provider, the maintenance of it, and the design and build from the contractor is very, very significant. And that's why when you look at examples of DNC or build only, where you just build it and then all of a sudden the operator takes it and says, hang on a sec, this is not designed correctly for this machine. So this is really important. The beauty about developers that bring these consortiums together is because they've seen this, they've done that in other countries, so they've learnt from that and the risks of that. So they develop these really tight interface agreements between the medical equipment provider, between the contractor, between the facility manager. And that is the dialogue between them and how they're going to share their risk. Because in the end, the PPP is not just delivering a partnership together, but it's also sharing the risk together.
Absolutely.
So, if you haven't delivered, you're not getting paid. So these are, and if a procuring centralized units do not understand the importance of that, this is where it can affect them as a straight contract or a D&C.
Exactly. And it's very interesting topic that you raised. I think it's interface agreements, because actually you couldn't find very many of them on the market. So I think would be interested if maybe with some partners we could look together and see what are the best practices there, how they are being managed, because market is changing. I see it from recent tenders. Previously, medical provider was always selected after the main consortium is there. Yeah? So, but nowadays I see in UK it was selected prior to the consortium. Mm-hmm. In Canada, it's done in parallel. Why? Because of this. Because they have to coordinate. The requirements are changing. Now we have totally different technology based. Yeah? So this is a very interesting question. Let's keep it in mind, and maybe we could think as what we could do, to explore more interface agreements as a concept, and maybe looking at some practical examples. I know there are lawyers in the room, so if you are working with interface agreements, please raise your hand, and maybe we do a workshop on that later on. And then actually something that I wanted to say, but no one mentioned this as a trend when we were thinking what happened in the last 5 years. We forgot to mention elephant in the room, which is sustainability. Right? I think this is the huge topic for all of us. And we see how that's been actually embedded in all type of infrastructure projects, and of course, healthcare. And I just have a quick question to the audience. Who from you is interested in sustainability? Could you raise your hand? I would say more than 50%, yeah?
Yeah, more.
Yeah, interesting, because I was last, sorry?
More interestingly, we should ask who is not.
Okay, who is not?
No.
One person. Well, I will come to you afterwards to ask why not, but I'm just curious. I think we should all care about this, right? Because there is no planet B. And unfortunately, I can't compare climate in Abu Dhabi, but I was last week in Lisbon. It was also 31 degrees there in October, and it was also not typical. And I actually read that Paris in 2050 will have the same temperature like Istanbul, and London as Lisbon. I'm sorry, as Barcelona. So could you imagine this? So I think it's quite urgent for us to take measures. We know that Paris Agreement has been signed and our countries commit to them. So interesting would be how we embed sustainability in healthcare PPP project. I think it's a very important question.
Yes. Sustainability in UAE government has been raised, and it's one of their major agenda. And of course, we all know about the 5 pillars of the sustainability. And at the end, it's for the human well-being, and to ensure that you have a good environment, good green, good security, good living, and so on. UAE government have an agenda of emission, which was mentioned, from 430 kilowatt per hour to 100 by 2030, and by improving even their GDP by 4 or 5% from the economy point of view. So doing so, they have to, that was, part of their green agenda. So that means it's, from healthcare perspective, we really need to focus how basically we can sustain that by providing the services in a green aspects. We did something in our project, especially in the cardiology, and we took all the measurements in terms of the sustainability and become an environmentally friendly. Of course, this is something even beyond the healthcare. It's all the stakeholders needs to come together just to meet the agenda of the government, because the government have a lot of it, and there is many of them already being mentioned, and they are working on them, and hopefully they can deliver it by 2030, especially when it comes to the carbon, to the green environment, living securities, and even food securities. So that's what I can give from my perspective, and I'm sure there is a lot will come during the discussion with COP28, which is, will be launched over here.
But in this PPP project that you are about to launch, do you
Yes.
what concrete measures you would mention?
We put the requirement as per the Dubai municipalities' requirements in terms of the building infrastructure, like green buildings, and we took all the standards into considerations. So to have more environmental friendly infrastructure. So that's we have taken into consideration, and definitely we will replicate it all in our project, and hopefully most of the projects which comes to the healthcare, it is more likely to be as a green friendly to the to environment.
All right, thank you.
I might add, if you look at the cardiology, it's a gold lead building.
Yes, exactly.
And, that is a typical example, which I think governments, especially the UAE, don't get enough credit for. There are minimum ratings that we see mandated by the procurer, like istidama ratings. These are all around sustainability. The second component and the benefit of the PPP is that when you're taking O&M risk, you're looking for things that are more sustainable, to lower your own costs, whether it's solar panels, etc. So you get the double benefit, and it's a timely discussion with COP28. But honestly, I don't think the governments get enough credit, even though they're oil producing environments. But what they've done through the procurer enforcing these mandates is allowing these, what we've seen as PPPs, these sort of sustainable buildings, and whether they're social infrastructure or hospitals. If you were looking at value for money, in the shorter term for them on a capex requirement, they'd rather not do it. Why do you need a gold lead building? You can go silver, or you can go whatever it is. But these initiatives to think longer term, we're seeing more and more being mandated by the procurers, which is amazing.
And this is growing on even before CCOE. So so I think the government's intention for the sustainability and the green building, it's there since many years, but now it is basically done into their agenda, and they have a target to meet it by 2030.
In 2050.
Yes.
And so I would just also like to speak about how we approach this, because obviously, IFC is a member of the World Bank, right? So for us, the climate is number one on the agenda. We are merciless when it comes to this. When we sign with a government around any transaction, we have standards that we have to apply, the IFC performance standards. And fact is, you're right to say, if you apply the LEED sort of certification, and the Boza Hospital that I showed is also the first one which reached this certification in Colombia, it adds to the cost. And we have basically a climate department, and of course they have a methodology to help us sort of value these added costs. But then in the financing, because the banks require also the application of these performance standards, right? Everybody is bound by the same sort of goals. You recoup this. So it's an investment, I agree, long term, but also I have to say for the financer, the lenders, it's of utmost importance. So it cannot be neglected.
You also have the sustainability reports that you need to provide the banks as well, which is
right. So it's a system which is being built, and effectively you have to comply with that system. Otherwise, your operators will have problems to finance.
Absolutely.
Now, it also applies to service-based PPPs, because even there, if you look at the one that we closed recently with the NCP in Saudi, the imaging network, also there you have a component of, on the waste sort of aspects, which is embedded into the contract. because you display also a network with this telemedicine, you're able also to reduce your emissions. It's very, very important. All of that is sort of the core of how we advise on the project. So I just wanted to say it's for infrastructure, it's for the climate, yes, it's also very, in narrow sense for the financing terms.
Yeah, maybe I could comment on that because I've seen various tenders. I saw, yes, you have to do that, performance standards, EDGE certification, what I've seen from IFC, social environmental plans, yes, but what I haven't seen is actually commitment to reduce carbon footprint. And I think this is missing because we actually the whole world committed to be carbon neutral, not carbon neutral, net zero, which is even more than carbon neutral, by 2050. And if we don't, every project that we do, every activity have to have this commitment. Otherwise, we will never achieve it. So this is my invitation to think about in the future, especially to the governments. And Sergio, over to you.
I would like to say that, of course, the building part is the one that takes the most, let's say, hit on the sustainability, but also all the equipment and consumables, etc. We need to promote a circular economy. We need to make sure that we account for the reuse and the refurbishment of the equipment and everything that is related to that. Also, the energy consumption of the equipment needs to be taken into consideration, and we as Siemens have a huge, let's say, attention to this matter, and we commit to. The goal is also to provide solutions for a net zero hospital for the future.
Yeah, I think it's a future net zero hospital. Yeah? And we also, by the way, Plenary. You just signed recently, I think it was a Sydney Metro contract, which is pledged to be carbon neutral.
Neutral, yeah.
Yeah, climate neutral.
Yeah, so we're starting to see that now across different parts of different jurisdictions where governments are really thinking around climate. And,
So I think this is amazing. This is really, I think, was the very first project in the world with such a commitment, to my knowledge. I might be wrong, correct me. But why not to do something to healthcare PPPs, right? We should think how we make the climate neutral healthcare PPPs, yeah? And we don't have such resources, but I see definitely you have a huge team working on, and with EDGE, obviously, where all the calculations could be made. It's very easy to give this assessment, what is required in order to reach the carbon neutral target.
I like when you said you have a huge team. We have huge teams, not only one, certainly not. So what I think is interesting also when we were talking about trends, there are a number of countries, and I can mention two, who ask us to consolidate existing facilities. So because they have outdated facilities which are sort of consuming a lot of energy, where maintenance is also a tremendous cost. They're asking us to help them consolidate, close outdated buildings and have one facility which basically is a green facility which is sustainable and sort of perhaps more adapted to the current trends. Because we know that you need basically less inpatient admissions nowadays, with the trend in medicine is more on the outpatient development. So, for example, in Uzbekistan, we are consolidating 5 or 6 outdated facilities into one. And I could imagine that this project may qualify for this, because, we replace outdated facilities with a new one, so, and more compact. Ukraine is also asking us right now, in the midst of the crisis, we are developing such a project, because they have of having too many facilities and the wrong ones. So, I take this point. I think I had never thought of this way. Obviously, we will apply the EDGE certification and other sort of certification requirements, but it might actually qualify for this. Thank you for the idea.
Pleasure. So let's maybe, we raised up a lot of important questions. Yeah, maybe I would give you just, 3 shots, whatever you want to maybe add from your perspective as an expert in healthcare PPP, maybe what barriers we are having, challenges, how to increase competitiveness, maybe because sometimes we end in with just one company at the end, because it's such a expensive, as we heard, and lengthy process that it's just not feasible for many companies to participate. So I just give you an opportunity, a carte blanche, to express your views on what you would do differently. Everyone is looking at me. I mean, we could.
I'm happy to start.
Yeah.
Can I mention how great DHA is and their beautiful project is wonderful? No, just generally with jokes aside.
This project in general,
Jokes aside, we're seeing a lot of PPPs around the region coming up. And I think Dr. Ibtesam raised a very, very good point. The procurers that are procuring these really should consider this centralized process of expert PPP, individuals or talents in this unit, because they are complicated. They do need extensive experience, and they do take time for the procurer to procure them, and then for the private sector then to bid them through. So having an understanding on how you do these interfaces, especially across healthcare, where you've got latest technology on medical equipment, and you've got the maintenance, and then you've got also the replenishment or the changes of these medical equipment after 7 years. Where does technology go? Who takes that risk? So there's so many things that you need to factor around financing, etc. So having that central unit, I think, is really important, and I can't emphasize the importance of it, because that then promotes the private sector to keep participating in these procuring deal flows that come through.
Yeah. By the way, don't feel obliged. If you don't, I mean, it's just an opportunity. If you forget to say something, then you could mention. But otherwise, I have a lot of questions, and we could also take questions from the audiences.
Well, I think on top of what Moustafa said, I would do PPP a bit faster in terms of, because it's a really lengthy process. So if you do your due diligence ahead and spend your time more on that, especially on your feasibility study, so when you're engaging with the market, you have to do it quicker and faster, especially in an area where a lot is happening, from politicals, economicals, geographicals, a lot, inflations and others. So I always will advise to do it even quicker and faster in that terms, and make sure that you don't go behind the wish list of the people. You look at the needs and the requirement of the population, not of the wish list of your stakeholders. So be quite precise, see what is the requirement and the needs, and what the market required, especially to give back to your community when it comes to the healthcare services.
Right. I would like to add, because I think what we didn't mention is the market sounding and how important they are. Because then it's a shortcut. Yeah.
Yes.
I mean, the consultants, they might do it, but you never know whether they're right or not.
Exactly.
So you have to validate this. You have to go to market sounding and say, we have this hypothesis. What do you think about? Would you be interested? Is it works like that? The more market sounding you do, the better visibility and the faster you would do. So we actually invite to have as many market sounding as possible, and also at the different stage of the project, a very early stage, and also pre-bid market soundings when you already structured the contract, and then you would, actually show to the potential bidders and say, are you interested? Yeah. And they might come from totally different jurisdictions where things done differently, so they could bring their lessons learned and advise you on certain nuances, very important nuances.
Yeah.
Also, I would like to advocate on a transparency of the process to know exactly where you are, because they're not so we cannot bid on a large number of parallel opportunities. So it would be great to be able to prioritize, also according to a transparency in terms of objectives and timings.
So this is an interesting statement, if I may jump in, about transparency. So the first question that governments ask us when they ask us to help, right, with transaction advisory, is like, how fast can you go? Can you do it for the day after tomorrow? And so I think, when we explain to them that we need a preparation project, right? We need to sort of go into due diligence, we need to test the market, we need a transparent process. They start to say, oh my God, what I will do is try to find one partner and do a direct bilateral deal. Well, interestingly enough, because we also have like a lot of studies, bilateral deals don't go quicker. Why? Because once the contract is on the table, the government then starts to look at it and think, oh my God, is it a good deal for me? And the governments have, courts, they have investigations and so forth, there's a process. So it doesn't go necessarily quickly. So I agree with you going faster because healthcare requires investments, but the preparation stage needs to be rightly done. After you can go fast and then you can replicate. And then you have the required transparency so that the qualified operators, not the cowboys, but the qualified operators can come in and bid on the right basis.
I think further to add, I think it's not just about faster, but if you're well prepared, as Dr. Ibtesam said, in advance before you go to market, and then you set your timeframes, market sounding, RFQ, RFP, award, or BAFA award, whatever the process is, and then you stick to that. It gives you then a track record. But preparation, I think, is most key. The more you're prepared, the more you can stick to a timeline that makes sense in terms of procuring a project and achieving financial close.
Right. I have hundreds more questions to you, but I want to give a benefit to our audiences in case you have questions. Raise your hand if you have any questions.
If not, it means we've been clear.
I don't see any hands. One, yes, please. You could go here.
Is there a microphone?
No, Mike.
Okay.
Hi, my name is Jeff and I'm from HSBC Bank. I just want to understand from the PPP model, what is the role of a financial institution bank? How can they be on the table before they need a financial flow for them? Like to hear about that.
Just give us an open check.
Yeah, so the question was, what is the role of the financial institutions, debt financier, equity financier, right, in the process of structuring the healthcare PPPs?
I can take it.
Sure.
So I would say that there could be multiple roles. What we see is, during the preparation, when we do the market sounding, we don't only talk to operators when we help governments to structure. We also talk to potential lenders, because that's as important as finding the right partner, operating partner. So if the financing is not there, there is no closure, right? And there are a lot of PPPs which close commercially, so there's a signing with an operator, or but there is no financial closure afterwards, so it doesn't help. So this interaction needs to be early in the process and understanding what financing terms, what are the key requirements for the lenders to then come in. The second sort of thing that we start to see is that the financing in certain circumstances in emerging markets where there could be some doubt as to how no financial closure could happen, we see the financing being stapled, so offered as a sort of option in the data room. And in certain jurisdiction, IFC is requested to do that. So we are able to do it and potentially have commercial banks as partner, so that the operators, when they come in, they know that there's the possibility to get this financing.
During our cardiology center of excellence, we did a lot of kickoff meeting, and we invite everyone, operator, providers, even payers, insurance people were engaged as well. And the other thing, we always advise the banks to immediately go and speak to Department of Finance, because they have a list of PPP projects, not only healthcare, even non-healthcare. So they can prepare themselves what is coming to the market. So this is something, and if you even visit DOF, Department of Finance website, there is a list of the project, PPP project. You can have an insight, what is going on, what is being executed, what is in the pipeline. So that will make you even understand how the market is going on.
Well, if I may add also to those, what was the role of financiers in healthcare PPPs? They keep the whole project together, right? And in certain jurisdictions, they don't want to invest unless it's a PPP project. And also, the only ones who have the whole picture. Because we see only a piece of the elephant. Yeah?
Yes.
Construction is company is responsible for construction, facility for facility. Only investors and potentially lenders, they want to see the whole picture, the whole business case, how it works, and they're interested in the long term. So I think they are enablers. Yeah, without them, the whole construction doesn't make sense. And maybe very last, if there are no any other questions, yes, please.
IFC, African countries decided to start PPPs I try to ask how do you see themselves in terms of money for the migration status and their governments and so on. At the end of the day, I think it's really strong. We currently get out of the market due to the fact that it takes time and it takes also a lot of money. I advise us, the right advice to start right? And they realize that
Yes. So this is the core of what we've been doing. I mean, now it's been 30 years. So in low-income country, what we do is we share the risk with the government. So we basically put a transaction advisory team. We sign a mandate with that government, and the government has to pay only a portion of the cost of the preparation. We mobilize donor money to do that, of course, because these are years of preparation, right? It could be from anywhere between, I think the shortest time frame would be 12 months to longer, right? And so we basically bridge this and recoup the donor money upon success. So if the success doesn't show up, obviously we lose the money, right? So that's why we share this risk. Now we put a transaction advisory team, we hire legal advisors, local, international. We hire a technical team depending upon the project. And we help the government from the beginning to the end. Could be from the very first concept to try to see what type of project could be successful to the very end. We do capacity building. We also help, as I was explaining, after the signing of the contract, to monitor the project. Because we think that this first 18 months after contract signing are crucial. If the government is not a good partner, then the project doesn't materialize the way it should. So that's what we do, in a nutshell, the core of our expertise.
Thank you. No more questions? Then the very last question, and we close our session. Value for money. I know it's a difficult concept, but in certain countries it's mandatory to form value for money. In some countries not. Would you agree with the statement that it actually is very important exercise, and if it's non-mandatory, required by the legislation, that you would do quasi assessment of value for money? Because you have to develop your performance outcomes, right? You have to develop your KPIs. So at the end of the day, you have to do this. So comment on that.
I mean, it is one of the tools that you have to use it in the project. I don't think so. It's very because there is a lot of other alternative way that you can measure your whole projects and how it's projected. We have to use it because it's a mandate from the Department of Finance and us. But to be honest, my personal view, why not? I mean, you can use other tools for it. But you always, for me, the NPV, it's making more sense than value for money. Value for money sometimes is positive and the NPV is negative. So, it's just like we just want to compare from one to another. It's not really a crucial thing. And by the way, when you operate a service, it keeps changing. The business models, everything's impacted with the whole external environment. So only if you project the value for money over 25 years, it's not making sense.
I think the best value for money is a competitive.
Do you have a question?
what we're starting to see, if there's lack of competition, where benchmarks start getting compared, especially when benchmarks are compared with countries that haven't done these PPPs before, or haven't done a healthcare PPP, or a school, or whatever it is. So when they're relying on consultants' benchmarks, for us, these bilaterals, we actually don't like them, even as the private sector bidding. When someone says you'll be the only one, no, because we're just going to get compared to a benchmark. The benchmark might be a domestic benchmark where they're comparing a facility manager that, cleans an existing place that charges an hour, while a PPP is an availability base. So the quality of the people we're going to put is going to be much higher, and the standards are going to be stricter because there's KPIs where we won't get paid for. Running a PPP management structure of a facility manager, the cost base of that is far higher than a local standard, facility manager that's getting paid by the hour. So there's so much differences. So when you start hearing value for money, the consultant's first step is benchmarking. Benchmarking creates an issue. So what we actually like as a private sector bidding is we actually like a competitive process, because then you're competing and you're comparing then the bids that are coming through.
For us as a government, it's just on the paper.
Yeah.
Okay, what you want to say, you do it pro forma.
Yes, I think it's an intellectually satisfactory exercise.
Exactly.
To have a nice report with a lot of diagrams, colorful and nicely binded, that you can put in the cupboard. Tick the box.
Yeah, exactly.
So it is, I think, an attractive methodology intellectually, but it is so challenging to do. And in healthcare, you need data, right? Data is missing. You need a benchmark. Where do you take the benchmark from? So you accumulate parameters,
Right.
and then end up with whatever result you would like to see. More interesting, I think, is the work on the drivers for value for money, right? The competitiveness, selecting the right project, having a performance scheme which is bankable and which is, with a few parameters which can be measured. All of these drivers are more important than the report.
Exactly.
Well, I just comment on my side. So value for money is not the financial performance of the project, because value for money includes financial and non-financial benefits. So it goes beyond. So you have to see what is the value for communities, etc., etc. So it's more in the directions what Sergio was saying. This is actually this value for people, value for innovations. They actually sit in this value for money assessment. And I personally, I agree that this was done a little bit pro forma, and you could play with the outcomes depending whether you politically in favor or not in favor of this project. But I think it genuinely believe that this is a very necessary exercise for governments themselves to do the self-assessment. And then what is missing, it has to be reviewed. And has to be reviewed after the project is already launched, together with consortium partners, and then see how they contribute to this value for money that you as a government developed, and see maybe they bring, after the tender, there is a new value for money. And then you would see when project evolves, how the value for money is actually, then you would come a real data that you could show to Ministry of Finance and all your stakeholders.
But most of the financial people, they focus on it because they think that this is the way the projects look so rosy. But if you look into more details, it's honestly saying something else. I had my hands on the project and I've seen the numbers, the way we projected and the way we ended up. I don't feel it's something that we need to use it. But honestly speaking, we need to use even different parameters to measure and compare the project itself. So I feel it's a kind of just for the paper to show the management, and that's it.
No, we should go away from that. So I think we done a very good job. Our speakers done a very good job. Let's give a big applause to them.